Hey, this is Dr. A with a medical terminology of video of the signs and symptoms and pathologies of the the lymphatic and immune system. We did blood in a previous video. All right, so let's look at signs and symptoms for the lymphatic and immune systems. So hives is the appearance of wheals as part of an allergic reaction. They're elevated little plaques, if you will. The redness looks like a bunch of mosquito bites without it actually being mosquito bites. Inflammation is a tissue's response to injury. It includes redness, pain, swelling, and feeling hot to the touch. Lymphedema is edema in the extremities due to an obstruction of the lymph flow through the lymphatic vessels. Splenomegaly is an enlarged spleen. Urticaria is severe itching that's associated with hives. It is linked to food allergies, stress, or drug reactions. And talking about urticaria, let's look at allergic reactions. So allergic asthma is an inflammation, a narrowing of the airways that is triggered by inhaling allergens, which could be things like dust, but also chemicals, cigarette smoke, all kinds of things can trigger asthma for people that have asthma. Allergic conjunctivitis is an inflammation of the conjunctiva that is caused by allergen in the air. The conjunctiva is the lining of your eye, and so you would get really swollen eyes and inflammation there. Allergic rhinitis is an allergic reaction that is caused by inhaling an allergen, and it gives you just either stuffy or really watery nose with a lot of sneezing. And an allergy is a hypersensitivity to a common substance, and that substance is called an allergen. It could be a pollen, it could be grass, it could be dust, it could be so many different things, it can even be foods. So, and the thing is, it's not a pathogen, it's something that's common that you really shouldn't actually react to. Anaphylactic shock is a life-threatening condition from a severe allergic reaction. You get circulatory and respiratory problems. It is also called anaphylaxis. And contact dermatitis is a skin irritation that's caused by the skin coming in direct contact with an allergen, such as a metal. Sometimes if you react to metal, the metal of a watch, for example, could cause a contact dermatitis. So let's look at lymphatic system pathology now. Adenoiditis is an inflammation of the adenoids. An autoimmune disease is a disease resulting from the immune system attacking its own body. Examples include rheumatoid arthritis, systemic lupus erythematosus, multiple sclerosis. There are many different autoimmune diseases. Elephantiasis is an inflammation and obstruction of the lymph vessels, and it results in enlarged tissues due to edema, and it's severely enlarged tissue. Hodgkin's disease is a cancer of the lymphatic cells found in concentration in the lymph nodes. Lymphadenitis is an inflammation of the lymph nodes, commonly called swollen lymph glands or swollen glands. Lymphadenopathy is a general term for a lymph node disease. Lymphangioma is a tumor in a lymphatic vessel, and a lymphoma is a tumor in lymphatic tissue. And mononucleosis, also known as mono, is an acute viral infection with a large number of atypical lymphocytes in the bloodstream. That virus is the Epstein-Barr virus. Non-Hodgkin's lymphoma is a cancer of the lymphatic tissues other than Hodgkin's lymphoma. Thymoma is a tumor of the thymus gland, and tonsillitis is inflammation of the tonsils. So this is the photo of a neck with a patient with non-Hodgkin's lymphoma showing swelling associated with enlarged lymph nodes. Here they're obviously cervical lymph nodes there because it's in the neck region. So acquired immunodeficiency syndrome, also known as AIDS, is a defect in the cell-mediated immunity, and it results in the final stages of HIV infection, in which there are a lot of pathogens that show up that normally wouldn't cause infection. So and maybe weird cancers, etc., that show up because of the lack of functioning of the immune system. So the AIDS-related complex, or ARC, is the early stage of AIDS. You get mild symptoms that include weight loss, fatigue, and anorexia. Graft versus host disease is a complication of a bone marrow transplant. So the immune cells from the donor marrow attack the recipient's body because it sees the entire body as foreign, because it is foreign to that bone marrow. Human immunodeficiency virus is HIV, is a virus that causes AIDS. It is also known as a retrovirus. This is the type of virus that it is. Being immunocompromised happens when the immune system does not function properly. It can also be called an immunodeficiency disorder, although some people can be immunocompromised just from chemotherapy for cancer, for example. A Kaposi sarcoma is a skin cancer that is seen in AIDS patients. You have brownish purple skin lesions that spread to the organs. Multiple myeloma is a cancer that originates in the plasma cells. The plasma cells are the B cells that produce antibodies. And over time, these malignant cells collect into bone marrow, and it's not curable. Opportunistic infections are infections that appear in an immunocompromised person. So those are the infections that would not normally cause infections in a person with a normally functioning immune system. Pneumocystitis pneumonia, or PCP, is a common opportunistic infection that happens in AIDS patients. So it's a type of pneumonia that happens in AIDS patients. Sarcoidosis is an autoimmune disease. It forms fibrous lesions in multiple organs of the body. And severe combined immunodeficiency syndrome, or SCIDS, is a genetic disorder. Individuals are born without a functioning immune system, so there are components of the immune system that are completely missing. They're not there. And lastly, we're going to wrap this up with nosocomial infections. So we have carbapenem-resistant Enterobacteriaceae, or CRE, infections. It is an infection by a group of bacteria with resistance to antibiotics. Those antibiotics are called carbapenems, and this occurs in healthcare settings. Clostridium difficile, or C. diff infection, is an infection that causes inflammation of the colon with symptoms that include diarrhea, nausea, fever, and abdominal pain. This is often a result of antibiotic use, especially the antibiotic that's used to kill the next nosocomial infection, which is MRSA, but it can also be spread from patient to patient in hospital and even in the community. Methicillin-resistant Staphylococcus aureus, or MRSA infection, is an infection with a bacteria that is resistant to many common antibiotics. It is spread through contact with contaminated surfaces. All right, and that wraps up our nosocomial infections and our signs and symptoms and pathologies of the lymphatic and immune systems.